Dr. Haynes, I do appreciate you, man. Appreciate you being the high standard that we need in the dental community, and I appreciate you taking the time to really talk through the impacts of COVID-19 for your practice. So, as you know, we're going to go through a few questions. I just want to really add value based on what you're facing, how you're thinking, how you're continually staying engaged with your team and your customers as you deal with COVID-19 like the rest of the world. So I thought this was a great opportunity to show your leadership because you're very awesome and you have a really great mindset. So just want to really jump into a lot of these questions. But before we do that, I would love for you just to kind of introduce yourself and kind of give some background about yourself and your practice.
Yeah, Dr. Haynes, Modern Family Dental Care is the name of the practice. We have 3 practices in Charlotte, North Carolina, and Concord. Basically, originally from California, a mechanical engineering degree. I spent some time in the .com back when it was popular in the late 90s. Lived all over the globe, Seattle, New York, Spain, traveled to Europe, came back and went to dental school, and now here I am, managing and being a president of 3 dental practices.
Nice. So everyone, you have a practice in North Lake, Concord, and then also the university area.
Yeah, exactly.
So real quick, like engineering degree, how did that shift switch from from being an engineer to now a dentist?
Yeah, I was always good at math and science. I liked it, and so I heard engineer, and I think I did like some research about, you can make $40,000 a year or something like that as an engineer. Like, oh man, that sounds sweet.
Right.
I'm coming from nothing, right?
Right.
But got into engineering, loved it. But then I realized after kind of going through it, I don't want to design doorknobs for my life.
Yeah.
Right?
Yeah.
And that's when I got into like business consulting, one of the larger big 5 consulting firms in the globe. Did that for about 5.5 years and learned about communication skills, working with people, team building, teamwork, how to deliver, how to organize, and all those little soft skills that people talk about, really learned in front of big time Fortune 500 companies. And then that's all problem solving the whole world is. And that's what engineering is. In dentistry, it's epitome of problem solving every single day.
Right. That's awesome, man. And I know you're in the midst of shifting and changing with the coronavirus taking full effect here in the U.S. So we'd just like to open up to these questions. How has it impacted your current practice?
Yeah. So, I mean, initially when it came out, we were maintaining, we're going to do emergency and necessary care. Well, what's necessary? In my opinion, it's making sure there's no inflammation of the gums, right? That's really important. Right. So we're going to hold steady until when more guidance comes out. And of course it came out. And so when that came out, then we actually really had to contract the schedule down.
Yeah.
Yeah. So no hygiene was huge. So now what do you do with your hygienist? Right. I mean, everybody thinks because you have a dental practice or a company, you just got money in the bank, and that's not how it works.
Yeah.
Now it works real similar to a personal bank account, right? You have expenses, you have money coming in, and you hope to have a little bit of a gap. No, if you're really fortunate, you have a big gap, but if you're not fortunate, you're going to have a minus gap because you go on a credit card, right?
Right.
Well, we'll do that. So, yeah, so initially, I mean, we were holding strong, had to then furloughed with all intents and purposes to bring him back as soon as we can, a hygienist.
Yeah.
So instead of 8 hours a day, we were doing 6 to 5 with hygienists, being as productive as possible. When they went away, then we condensed everything, all 3 offices, into half days.
Yeah.
Right, with the hope to do, again, with the more guidance of what we can actually do with emergency care and moderate to severe cavities and other things. We focus on that. Well, with the other practices not being able to see the volume needed to support their salaries on payroll,
right,
had to make the decision to close those offices and furlough those employees. And so now, current week is we're at Concord Mills, which is the flagship office. We have basically two front desks, 1 insurance coordinator. That way we can still get the residual money coming in,
right,
pay bills, and then 2 assistants myself. And so the whole purpose of that is that we will still generate income, take care of patients, provide that service, stand out, because I know a lot of dental practices shut down.
Yeah.
Right. And that's going to be hard to start back up. Right. And so now we got a little steady flow kind of happening, and when it goes to start back up, we're gonna go pedal to the metal. So that's how it impacted us.
Yeah, so that's awesome to hear. And you it sounds like you adjusted and you pivoted pretty quickly, and you had to do what you had to do when you have three operating practices and you had to scale to one, and kind of relieve some of the employment, but the goal is to bring them back when things get back steady. So it's good, and it sounds like you have a game plan, and that's one thing I really like to hear.
Well, I tell you, it's funny because every Thursday we have weekly leadership meetings.
Okay.
What's working well, what's going good, how we're working on our action item list, right? What are some of our priorities? What are some issues we got to solve together as a leadership team? And so, 3 or 4 weeks ago, we had our Thursday meeting, and like, man, this sounds good. We got a game plan. We're gonna make it happen, right? Friday hit, news came out. Forget about it. We got to change back up.
Right.
Following Thursday, same thing. Feeling good. Change back up. And this past Thursday, we had our first quarterly meeting of the year, which we talked about all the things we achieved, what our priorities for the next three quarter or 3 months, issues, etc. Right? And we focused on our game plan to transition back to full time, which we're trying to estimate a date.
Right.
And so we had a game. Everybody's feeling good. Great meeting. We're doing it. 2 hours later, this is on Friday, so last Friday. 2 hours later, here comes the governor. Bam! CDC. Boom! Boom! Hey, you know what? Forget about it. Here's what we got to do.
Right.
Half days.
Right. Yeah, and the thing is, like, you had a game plan, but again, I think the big messaging or picture there is you're able to pivot, even though it's not a favorable pivot, but you're pivoting and adjusting to make sure that you can be successful on the other side of this.
That's the biggest thing, right? You don't get lost in your thoughts.
Yeah.
You could think too much.
Right.
And when you think, you're not making decisions, right? Decisions should be like that.
Right.
And so you make a decision, you act, and as long as you keep moving forward, that's all I'm trying to do with people and myself is move forward with this, then you're headed towards something or your goal, right?
Right. No, that's awesome, man. And to that point of like being able to pivot, how have you pivoted in terms of making sure your current practices are safe when you do see patients, with the standards that, COVID-19 is causing us to have?
Yeah, it's interesting because we deal with a lot of bacteria, viruses, and fungus every single day. So it's nothing new to us, right? What is new is the fact that this is somewhat of a new strand of a virus that we knew about, and people have a fear about it for whatever reason, right?
Yeah.
So, from my personal standpoint, I'm not afraid of anything because I deal with everything. I have the proper protection equipment.
Yeah.
I mean, we sterilize like nobody's business. Our disinfectant procedures in the operatories are really, really good. Usually it's one single patient and me and an assistant, or a single patient and a hygienist. There's no people loitering around in there. Right. So from that standpoint, environment standpoint, it's really, really safe. However, you gotta take the recommendations seriously because of the fact that those things are being communicated through the masses.
Yeah. Right.
And you don't want to be somebody who's really trying to go against the grain. I say, no, I don't need it because we're already good. You want to make sure people are comforted when they come into their practice, and also to make sure that you're doing everything you can to help prevent that spread of the actual virus, right? That's the main thing. Right. So the things we do, of course, we're asking, hey, fever, sick at all, please not sterilize your hands, but sanitize your hands when you first check in.
Yep.
You go in the operating room, the treatment room, sterilize as well. Of course, there's no hygiene, but when we're doing hygiene, we actually got rid of all the aerosol, the piezos and everything else. Everything was done by hand.
Okay.
Asking patients to rinse with a chlorhexidine rinse to help kind of kill the bacteria. Anything kind of present in the mouth at that particular time that help. The aerosol that may be happening, it's going to be more benign to me and the assistant.
Right.
That's pretty much the main things that we're doing. And also we started up front in all the different common areas, door handles to bathrooms, the doors to the outside, and anything people can touch, we're kind of wiping down. No magazines, right, at all. So right. Yeah, just taking the precautions that make people feel and have comfort coming to their practice, because everybody's so different with it, right?
Right. And that's, that's awesome that you guys are doing that. And it also sounds like you had a standard in place for very high cleanliness. And I feel like, as we get out of this, what's going to happen is still the mindset is going to change with everyone in terms of how they interact and engage. It's going to be like that for a while. So I think you guys are putting the right measures in place to continue to make them feel comfortable. So that's awesome.
Yeah, there's no right in this, right? It's just everybody, whatever they think is the best thing for them, then they're right.
Yeah.
Right. I agree with that. Perfect. No problem. We're going to make sure we're going to be as germ free as possible.
Right. That's awesome. So I guess for you, like, how in your mindset have you developed certainty? Because even in uncertain times, as a individual who you provide a lot of inspiration and motivation in the community. How do you, even when you're down and you feel uncertain at times, how do you still tell yourself or provide that certainty in your mindset so that you can be ready for after COVID-19 is over?
Yeah. I kind of view it as a muscle. I mean, it's not easy to get there, but what I have learned to do, like for instance, Lamar, tomorrow, what's going to happen? Do you know what's going to happen tomorrow?
What's that?
I'm asking you, what's going to happen to you tomorrow? Do you know?
I have no idea.
You're uncertain about it, right? Yeah. So I don't know what's going to happen to me tomorrow. So I embrace that, right? Tomorrow's going to bring a new freaking day.
Yeah.
Right. No matter how good or how bad, I hope it's great.
Right.
However, right? However, I know that if whatever's going to come my way, I'm not going to stop or quit or roll over and die.
Right.
Right. That day will come when I do pass away.
Yeah.
But I'm going to keep them. So I embrace that. I embrace that certainty, just knowing that I will, no matter what comes my way, that I can do good things, I can do great things, and I will overcome. Because the only way I'm going to eventually fail is by quitting.
Yeah.
Now, I make mistakes. Things don't go my way. Outcomes are not the way I want them. Again, I just embrace it and take responsibility for it. And so, again, it just comes to the fact that you're able to see kind of the problem, right? You own it, right? You take responsibility for it. You don't deny the reality of it all. Don't make excuses, right? It's not your fault. It's not my fault. It's over here, where else. And you have that ownership of it all. Yeah. Then you're able to actually solve that problem where it comes your way, and you just keep moving forward, right? So I don't think too much. I have my thinking time, of course.
For sure.
But I'm making decisions, and I'm moving. I'm making action.
Yeah.
Right. Awesome. And it's like a rhino. A rhino, man, it has straight ahead vision.
Yep.
They move forward. They put their head down and they run at the target. Right.
They take ownership.
They go, I'm going to get that thing.
Right.
It's a rhino mentality.
Yep.
And that's what I do. Like this whole COVID thing. And it sucks.
Yeah.
It sucks. But what I want to do? Cry about it?
Right.
No, I mean, I'm going to fold and give up.
Right.
Unfortunately, there's going to be a lot of dentists, a lot of business owners. It got hit pretty hard, not only with a 1-2, but it got a 3.
Yeah.
And they're going to make the decision that they can't go on.
Right.
And that's their choice. I'm not making a decision, right? I'm going to keep on going. I got bigger things I'm trying to achieve.
Right.
And then until I get there, then I'm going to keep on going. But when I get there, what's going to happen? I'm going to have bigger goals.
Bigger goals. Bigger goals.
Yeah.
That always is.
Yeah. So that's a big thing, man. I just ownership, accountability, making sure I do it with discipline and everything else. I'm not going to make excuses.
Right.
I'm not going to deny reality. Then I'm not going to blame others. Just move forward.
Yeah, and I think that shows, like, the next question was about your leadership capabilities and how you're still developing that. But I think what you just said shows all of that. All the characteristics that a leader should have, especially in this time, is demonstrated through, your care for your team, care for your mindset, the goals that you continue to set, and, how you have that rhino mentality of continue to push forward no matter the circumstances. Because in this case, we can't control this. Like, there's nothing we can do besides the precaution measures of keeping or staying at home or, keeping ourselves sanitized. So, I think from a leadership standpoint, like, to run a business, you have to have that mindset of what you're talking about. And I think a subset of that is really from a leadership standpoint, how do you stay engaged with your team? And then the second part of that question is, how do you stay engaged with your customers? Because at this time, we're a little disconnected. So how do you stay in front and engage with those two different types?
Yeah. So With my team, like you said, no, it's all about attitude.
Yeah.
I gotta stay positive. I gotta set outlook. I gotta provide the words of encouragement, provide the words of vision. And today I say, no, this sucks. We're going through this, but I have no doubt in my mind that when we come on the other side, we're gonna be around. We're gonna be even better, right?
Right.
Maybe you hear that, the confidence in my voice, the attitude, right? No, I forget the saying is, but it's like a leader who's a lion, a leader of sheep who's a lion will actually beat the lion's head by a sheep.
That's good.
Something like that, right?
That's good.
Yeah, because you take on the passion or the energy from the leader, a lion, a rhino, right? I'm from a sheep, I'm folding. What's everybody else going to do?
Right. They're going to fall.
Attitude, yeah. So that's one of the main things I try to convey to my patients, also my team. Now with the team, I was doing weekly videos that I would send out to them. Hey, here's a plan. Here's what's going on. Here's the more information coming down. Here's what you can believe. Here's what you can and what you got to kind of fill out for. Right, but this is back before this past Monday where I had to furlough people. When people are on furlough, you can't communicate work stuff.
Right.
Legalities, right? And that's work. So now, because it's a small little office, we just have our daily little huddles. And today we talked about some positive things we're actually doing for ourselves to move forward. Right. So encouraging stuff. When it comes to patients, one thing I try to do is just stay out there on social media. I'm big on Instagram.
Yeah, you're killing it.
Yeah, just big on Instagram because that's where I feel people go to kind of do the recon research on you, say, who's this guy? What's this dental practice about? Little videos, hey, we're still open, here's what we're doing. Little photographs of us. That's probably the big thing. I mean, obviously, not obviously, because I think a lot of people don't do it, but that we have a pretty strong, robust email program, always in front of patients.
Oh, yeah.
And then also what we're doing too is that we're going an extra step. We're actually generating like a list for an office person.
Okay.
10 to 15 people per day, right? Maybe we've seen them before, maybe we have a special connection with them, but all we're doing is simply making a phone call and say, hey, Ethel, just calling us, Dr Haynes at the Modern Family Dental Care. I know things are kind of rough. I'm just reaching out to see how you're coping with everything.
Right. That's
awesome. Yeah, my family's great, right? Oh, hey, that's all I'm calling for. When times get a little better, hey, just know we're here for you. But please take care of yourself, be well.
Yeah.
Right? Just a little outreach. That's all we're trying to do. And so, it's been a little different. And the one thing we're going to do once it's all over is we're going to actually do a grand opening.
Nice. That is genius.
Yeah.
That is smart, man. That's awesome.
Yeah. So we're going to run some different specials, kind of brainstorming through now, whether it's Invisalign, cosmetic stuff, implant stuff, restorative, whatever it may be, because hopefully now people will be more awoken, or whatever the word may be, to the importance of an immune system.
Yep.
And the immune system can be changed so quickly if they do the right things. And one of the things that they really need to do is to make sure that there's no inflammation in the body. Yeah. But of course, there's diets, there's exercise, but there's also a component of the dentistry, right? The mouth.
Right.
Number one source of inflammation are the gums.
Right.
So you can definitely focus on that once we turn the corner here.
Man, that gave me the chills because that's a whole nother marketing strategy of that grand opening. Like, it's a different mindset perspective when things are back to normal. Like, who is this? Like, that's really creating a different standard for dentistry, and you're already thinking ahead. And that's what I love about working with you guys is thinking ahead. Whether this 2 or 3 or 4 months down the road, you're thinking about how can you engage with customers when they're ready, right? And I think that's so powerful, man. That's awesome.
Yeah, I could be at home watching what's that thing on Netflix? People are watching something Tiger, whatever it is, right?
Yeah.
Yeah, I could be doing that, but I can't do it, man. It watches me. I can't do it. Yeah. So one of the things we're doing now is, we think about this. So I'm assuming May 4th will be the day we can actually open back full tilt again, right? That's 4 weeks away. Because of the work schedule of everybody, I don't have my leadership team there 4 days a week. I have my leadership team per person 1 day per week. Okay. Right? So then they got 4 working days to get the ship ready. So now what we're thinking about is, now think about this as opening an office. Supplies, we're gonna have to be there. You know, of course, we had to cut back on cleaning crews, so we're gonna have to make sure the office is clean. We're gonna have to make sure it's spot free. You know, vacuum, toilets are clean, everything's in place, everything's working properly. Right. Think about all the different things we have to do before May 4th. When May 4th comes, we're turning that light on. We're acting like this will never ever happen.
Yeah.
Right. Yeah.
And to that point, you're really thinking. Your mindset is almost like a startup again.
It is.
You're more experienced and you're more established in the community. So that is a mindset like you just can't. I don't know if you can even teach that. It's just you have it. That's all I can say. And it's good to see that you're thinking that way for sure. I mean,
and well, here's the good thing about it is that it's a startup again, but now we actually have a patient base.
Yeah.
All right. So we're going to get back into the swing of things faster. 2 is that we're going to be able to really be intentional and focused in on all of our systems and how we do business.
Yeah.
And I think there's going to be a lot more buy-in, a lot more gratitude, and a lot more focus on behalf of all the team members.
Right.
Because of what happened. Because I realize now, in my gosh, in a blink of an eye, what I thought was abundance.
Yep.
And I'm entitled to a job. I can do whatever I want to do. It ended overnight.
Oh yeah, you're exactly right.
They're coming back, and they're going to have more of the mentality of me and be open. You know what? I'm making these phone calls. Right. I'm making these emails. I'm going to do the best thing I do. When I present treatment, I'm going to let them know the value of why we're offering and how it's solving their problems. And we're going to do it the right way. And I know old Dr. Haynes over here, you know, he was just want to talk him. I get it now.
Yep.
Right. So, yeah. So those are the 3 benefits I see that really going to stand out as we get out of this.
And to that point about COVID-19, the real value when you look at COVID-19 from a business standpoint is when everyone gets back to normal, especially businesses, like that's going to be now there's a different hustle. Like the mindset and hustle is going to be totally different to serve patients. Even though you have great standards and you're exceeding the levels of dentistry. But then there's another level of hustle because everyone, even in growing businesses, there's some complacency. So this is resetting everything. So I think that's the beauty of, you know, thinking about COVID-19 when we get back to the grind, so to speak, is your team is going to be ready. And I think because of your leadership and your mindset, you're helping them get there. And then to that point, it's like just calling patients to tell them, you know, you're thinking about them. Because right now even though you're still doing marketing and you're executing from a digital standpoint, there's no reason to be over aggressive and salesy right now because people need to know you care. And that's going to help win relationships when COVID-19 is over. So I think what you're doing is a very, very strategic, smart, intellectual strategy for getting in front of patients. Just let them know you care. And I think that's the right mindset for sure.
You said 2 key words there. One is service, right? It's providing a service to people and not be salesy.
Yeah.
Right. You want to serve people, serve them. You don't want to be gimmicky. You don't want to try to manipulate. Right. You service them. They all have goals. They all come to you for a particular reason, and you service that particular need. Right. And so those companies that have been really good at servicing people, I believe they're going to stand out. I feel like our dental practices really try to service people the best they can, and that's going to really stand out versus something over here in a big box, all about volume, drill and fill, and money. Whole different feel, right? That's kind of, I think, going to take a little back seat. It'll always be there. But then also, second thing is, and this is for any company, is that I'm not in the dental business.
Yeah.
You're not in the advertising business.
Right.
And you're really good at this. We're in the people business.
Yep. You're exactly right.
Right? I mean, I got to take care of the person. I got to take care of the patient. I mean, and if I have confidence in the fact that I know my dental services and solutions are great for you, fine, no problem. I can communicate that, but I'm going to take care of you.
Right.
Like you do the same thing here. Yeah, man, I can do all this funny stuff. I have whatever. Hey, whatever I got to do, make sure I take care of you. Now I'm going to make sure I'm here for you. I think you said we're going to make sure it happen, and we're going to do it. Like you said, a lot of people cut back on marketing. First thing goes, boom, gone, right? And I think I called you. I said, man, you know, my first expenses, man, it's not an expense, it's an investment. I'm not going anywhere.
That's awesome.
right? Yeah, because of the importance of it, and I think that's a testament of your philosophy of people and service.
Well, that's it. You hit the
Right.
nail on the head, man. And that's I think if you're not running a business with that mindset, when the customers are what keeps your business going, if it's not people and service, then I don't know what to tell any. I don't know what to tell you. Like it's just backwards if you don't have that mindset.
Yeah.
I think where I think especially in this in this interview for you is for other dentists, like the way you service, the way you think about people. What even inside of your business, if you could give a dentist one advice, maybe a new dentist or even a more established or experienced dentist of what are you now? If there's one thing that you're saying, hey, this has to be more efficient when we come out of this thing, what would that be? From an operational standpoint, a people standpoint, a leadership.
Yeah. I'm gonna say it's the leadership of the doctor owner. Okay, but there are three components.
Okay.
All right. And the first component is that if you don't have a mission of what you're trying to achieve, you got to be crystal clear what you're trying to achieve.
Yeah.
Right. Like, no, we create beautiful, confident, healthy smiles for everyone. That's our mission, straight up. It's on our website. For homepage, it's right there for people to know.
Yeah.
We say it every single day in our practice. Second thing is that you got to be crystal clear on your vision and kind of where you are in your niche, right? We're trying to be one of the best dental implant practices in North Carolina, right? And we're looking to enhance, transform, and save lives with all the different services, right? We say every single day. So collectively as a team, no, like I said before, no, this is kind of fuzzy stuff. No, but we're going to say it over and over to the point where you actually start to believe it.
Yeah.
But then I think the one mistake I really made, and I've started to correct over the past couple years, is culture.
Okay.
All right. And what I mean by that is because, I'm a nice guy. People kind of follow and lead or whatever. Oh, hey, I'm nice. Woo, you do great. That's not culture, though. And so what I mean about culture, like, what type of values or fundamentals do you want to exude in your team, outwardly to all your patients, and what you live by? What's your code, right? And I incorporated the culture of humble, hungry, smart. And so under those, there's different values that we talk about. So, doing what's best for the patient.
Right.
Focus on the solution, not the problem. Blameless problem solving, right? Have fun as part of it as well, right? And so that's what I'm trying to breed with our think. And then the extra layer of more efficiency around the culture is really holding people accountable to that and stick by it. Don't let it slide. I was nice. I let stuff slide, right?
Right.
So if you can do that, I tell you, man, it's over the past, every month that goes by, it gets more strong, more fortified, and it's a lot better environment and better service that we're actually providing people. So tough thing, but culture and leadership.
That's awesome. And I think that's so key because even when you hire people, if that's the message and you have your culture and your mission in place, they will level up to that and become that, or they'd be close to representing that. But if people don't represent that eventually, then they're just not a good fit in your business, right? And it's easy to make those decisions. But if you don't have those things in place, then you're going to struggle with understanding, was Susie a good fit or not, right?
Yeah.
And really the camaraderie and team environment that you're creating for your business, those things have to be in place. And what you'll see is like a lot of dentists, just in general, some of them don't even know their value proposition. They're just like, hey, we're going to do good work and that's it.
I fill cavities.
Right.
What's good? I don't want my cavity filled.
Right.
Forget all that, man. I'm not coming to see you.
Right. Yeah. Exactly. So that's good to hear, man. Like culture is, and I think dental practices need to hear that because we work with a lot, right?
Yeah.
Seeing you kind of take ownership of that and put that at the forefront is so valuable in the industry. So thank you for that.
Yeah. It's a very simple thing, but it's not an easy thing, right? You said you hire people, you have the values in place. You look for them in your interviewing questions, right? You bring them on. And then the most important thing that we do, I talked about accountability.
Yeah.
is now we actually incorporate it every 3 months. Actually, a little bit more frequent than that for if you're new. We have our list of values, and we want to know if you mostly do them, sometimes do them, or don't do them at all. And the ones if you don't do them at all,
Yeah.
you're going to be canceled on them. Hey, look, here's the deal. No, do what's best for a patient, all right? Or quit complaining and focus on the solution, right?
Right.
It's better, fantastic. It doesn't get better, hey, what's going on? What's going on here? Come on, let's happen. Let's make it happen, right?
Right.
And get to the point where it's like 90 days and we get improvement. Well, guess what you got to do? You got to make the hard decision.
Right.
Right? You got to stick by it. So yeah, so those little components you put in place, man. Like you said, then you have people who will be there. The team will be all about it, and they actually won't tolerate people not performing or living by those values. Right. And they even see those people out the door, which is fine.
Right.
You get someone else who actually wants to be about it because it's going to be that much better.
Right. You're exactly right. And I think part of that is, from an operational standpoint, a culture standpoint, you have to be able to set those standards to make sure you're servicing, back to your point of servicing customers the right way. You have to have the right people. And that's right. And they have to meet those goals of what your mission is, what your vision is, what your value proposition is. So that's awesome. So we'll jump into like the marketing side of things, because I know that is where right now you're not getting a ton of patients, and that's for everybody. Businesses are not getting a lot of customers. So it's one of those. It's back to the mindset and leadership. Do you pause everything and kind of wait till the storm ends, or do you say, hey, we're gonna keep this going so that when we are on the other side of COVID-19, that people are ready to find us. People can find us online. People can book appointments. We're ready to, take on the influx of new patients. So what is your marketing plan? And I'll speak more to obviously what we do as well for you guys, but from your mindset, what's your current marketing plan?
Yeah, so the current marketing plan is a continuation of what we essentially have done with our foundational work, which is our website and our SEO digital real estate space, right? Get more of our finger threads through all the different keywords, more volume in a sense of the lower keywords on up, right? More of a presence, better rankings. So that we're not stopping there whatsoever. We touched upon social media in the standpoint of staying engaged, who we are with the Instagram, actually reaching out people even through the direct messaging who are in the Charlotte area, saying, hey, it's who I am. We'll offer this for you. Limited kind of digital advertising dollars out when it comes to like Facebook ads right now, because don't want to get lost into the whole hysteria people are looking for, viruses, whatever else. But we changed our PPC, our Google pay-per-click, right, to be more emergency based. Right. People looking for tooth extraction. Well, let's take advantage of that. People looking for it. So that's kind of the current span. And we also kind of pull back on some of the other mediums, whether it's long commercials, implants, specialty solutions, anything like that. That don't make sense to spend money on that. So right now it's all about emergency based, and then once we kind of pull back out, get the cash flow running again, that's going back on all the different channels and really kind of hitting it hard, and hopefully before others do, because they're still scared, timid, and may not have the slingshot plan bouncing back like we have, right? Right.
And yes, you're definitely you're in a different lane, especially when it comes back to mindset and leadership again, because you can see where you can see where you're going, and I think that is so key for any business to be able to project and see where you're going, to know that this will end at some point, but we have to stay the course, whether that is cutting back on some things, but the mindset of marketing is an investment versus an expense. It's like anything. Like, are you going to invest in yourself for future results? Because as you know, with digital, and Rome wasn't built in one day, so you have to invest for the future, right?
Yeah.
Business is not going to grow in one day or 2 or 3 months. Yeah, we're in an unfortunate situation, but businesses they lose money in several months outside of catastrophic events, but they lose money. But they still have to keep going to get to that future goal. So one thing I want to dive into like live while we're on this interview is really look at a comparison between March and February. So, what we do is we really handle, the full comprehensive digital marketing strategies for you guys. And these numbers are not great at this point. Some of the numbers are not great because of the circumstances, but there still are some nuggets that we can pull out of here and say, well, there's some opportunities to continue to develop the trend and the processes for you to stand out, or your practice to stand out once it's all said and done. So if you can see my screen at this point, so we're looking at 4 major marketing channels. So Google, direct website traffic, someone searching your website directly on their browser, social media, of course, and then referral traffic is just you being mentioned on other websites such as Yelp, and people transitioning to your website from a referral. So if you look, traffic is down almost 27% or 28%. But the nuggets in there is that direct social and referral have the largest drops in overall traffic during this time frame. Google is only down almost 11%, but the nugget there is that Google is very intent based. It's very here and now, that they're searching for you when they need you. So people are still searching, but just not as much. But you can see the value in that. You're still not going to lose a lot of value organic traffic from Google that's very intent based. And you can see that with the numbers. Now, what's interesting about that is if you look at the column where it says bounce rate, the fourth column, the fifth column, your bounce rate was up 4%. So that means, yes, people are not searching as much because they're so concerned about COVID-19. But when they do land on your site, they're spending more time because they now have more time to spend to really figure out, is this the right dental practice for me? So that's a very, very positive overview of, even though the traffic is down from each marketing channel. And then one other cool nugget is if you look at where it says conversions at the top, and it says goal, book an appointment. So, we have goals set up on your website where someone can come in, put their information in a website form and click submit. And those customers are booked or counted or attributed as a booked appointment coming through your book appointment page on your website. That was up 100%.
Wow.
Month over month, even in March. A lot of your patients still will book through LocalMed, because LocalMed is really a tool. It's one of our agency partners to help convert leads into patients. So a lot of people still will go there. But now we're seeing more people also go back to the website, which is awesome. So even in the midst of all of this, which is crazy that your booked appointments are increasing on your website. And then one other nugget to show you is your overall keyword landscape. So overall, like even if you see back in 2015 when we first started, and then just the overall growth, it's trending in the right direction. And that's the mindset that we're talking about in terms of, you got to keep going. Like, you got to keep pushing. You got to keep, optimizing. You got to keep creating these, or keep analyzing for the, what the behavior is in the search landscape, because it's very intent based. So if your traffic from a keyword level standpoint is up, 20%, even in the midst of everyone staying home. So that what that tells you is, a lot of competitors may be slowing down or pausing their marketing, and you're still going strong. So now you're going to be able to take some of these keywords that may have been more difficult to rank for in Google. So it's just really encouraging to see. And then we briefly talked about LocalMed, and LocalMed, even in March, you had 42 LocalMed appointments. Now, whether you booked those or they actually came to your practice, that's a different story. But 42 appointments booked, even in the midst of the craziness that we're going through. And then 73% of those were new patients. Out of that 72%, 50% of those were emergencies. So it just shows you how the ADA, when they said you can't focus on elective, you can focus on more emergencies. Your practice is adjusting in terms of appointments based on what's happening online. And I think what you're doing with the grand opening is awesome, because now we can prep and strategize for that grand opening kind of ceremony to really show people you're waiting for this opportunity to really service them. And as your traffic and your keywords continue to rise, like you're going to be standing at the top, man. And I love to see this, this trajectory with your performance. So it's awesome to see.
Yeah, just a few notes here. I'm looking at this. One is from January 12th, right? I opened with some savviness. Like, you know what? I want to get my place in the internet world, on Google reviews before they're really popular.
Yeah.
And you can see with just the website I had initially designed, which wasn't a prepackaged one at all.
Yeah.
An advertising firm. I think it was maybe back in about 15 or 16. Yeah. I had a revamp to be more responsive. And again, another SEO firm helped me out with all this stuff, right? All the talk. And you can see nothing really transpired from 12 to really middle of 2015, or the third quarter, right?
Yeah.
Then I kind of roll and kind of get involved with some of the larger national-based firms, and then you can see that in 16, yeah, kind of a little bit of bounce, right? But I'm paying goo gobs of money for that type of return. Right. And around January 17 or so, yeah, maybe before, 17, 18, well, with a smaller localized firm, got like a little bit of a bounce, but then you can see even having over 2-3 years kind of up and down and not really much progress. But then we start working together June of 2019. Yep. And you see basically got back to my highest level ever. Yeah. And about to double that. Right. And so that, this just shows you, talk about vision, and you know where we're going. And we may say, man, I can see where we're going, and here we are going. So I think it just proves the value of what you actually do for people. And then also too, you talked about local med and how that tool can schedule people. I think it's really, really a powerful thing, because we're going to be creative with it by sending links to people. Hey, you can schedule an email. Yeah. By clicking the link, text, click on the link, whatever it may be, website, right? But just for instance, today, and how we're getting through these times is, yes, people are scheduling emergency appointments. I haven't seen this patient this happened today, probably since 2017, I think. So about 2-3 years. Okay. Overnight, he scheduled an appointment for an emergency. Guess what? He comes in, he needed a root canal in the crown and a tooth pulled. That value of that appointment was $3,000 right there. Wow. Right. So that is, not only does it essentially kind of pay for the local med for the month, right, but it also pays, essentially for your services, right? By all those recommendations you actually have had and by all the work you have done. So it's invaluable. It makes no sense why anybody would say no to you or to your services and what we're trying to do. And if they do, I'm a pretty big guy, not as big as I used to be, but we can go, rough them up a little bit.
I appreciate that, man. You've been a champion for MedRank and our services, and it means a lot. So we work for you guys, and we love to see this trajectory and growth. And I think we're just scratching the surface. Like that's the cool thing about this. And one last thing I'll show you. So this is brief. Your website traffic is down in March. But if you look at, from February to February of this year, so 19 to 20, like just the overall trend and growth per marketing channel was pretty awesome to see. So I just, like, for you guys, I think you're going to dominate Charlotte. Like there's no question about that. And I think, also for you guys, some marketing strategies that we're thinking through as you guys are continue to, kind of wait patiently, is you over deliver, like we talked about. You over deliver. You're now offering that 10% off by scheduling appointments before May 1st. So that's an over delivery. You have the wellness plan that provides 20% off of payment options for certain procedures. So that is over delivery. And I think a lot of people don't have insurance. So when you have a wellness plan at that level that can provide that value, that's just overall value and delivery that most people are not seeing. So I think that's part of what you guys are doing from a marketing strategy standpoint. And then to your point of constant communication, so yeah, you guys are communicating through SMS, through phone, through email, through your website. You have all the notifications up on your website. So I think right now, showing patient certainty and that you're going to be here and that you're still ready to service them and overly communicating with them is going to be key. as you fill your schedule out, right? Like, yeah, like you're going to have cancellations. You're going to have appointments that are not going to be set because of what's happening. But this gives you an opportunity to reschedule them for a future appointment. And then to your point of Google Ads, right? Like cost per click right now is so low, and it's going to continue to go down because there's just not as much competition for Google Ad keywords. And I think we just launched your Concord Mills Google Ads, so we'll have more data there. But I think when we look back, it was an opportunity that you guys were able to get in front of some patients that you may not have been able to with still running ads. And then I think from a video marketing standpoint, you guys are, I mean, I think you sent us, 20 plus videos already as of yesterday.
Yeah.
We're just trying to keep up, but I think it's not even just about dentistry. You're addressing, to your point of how to be healthy, oral health, mindset, leadership. And I think not just even your patients can enjoy these type of videos and find them very valuable, but your peers and your colleagues and so forth. So I think the community needs it. So I'm looking forward to rolling out, marketing strategies through social media, also video marketing strategies, and then content strategies through those videos. And then lastly is really just hyper focus on SEO. A lot of dentists are pausing what they're doing, and it's understandable. But I think what you guys can now do is take ownership of some of these spots in Google to be able to really show Google you're still progressing through the challenges, and not again to be salesy, but more so you're a leader in the industry, and Google's algorithm is a robot, but they can see that through your marketing efforts, and I think that's powerful. I guess my last question for you would be, what are you excited about in terms of for your business after COVID-19? Like, what are you, even though we're all in the midst of a chaotic, situation, but what are you most excited about? Like when we all come out of this, like from a personal level and also from a business standpoint, what are you most excited about?
Fulfilling our vision and being significant in the community.
Yeah.
Right. Man, this is kind of a setback, but again, it's a setup for the future. With people responding in different ways, you're going to respond in a way that I like to try to respond, be positive, and keep moving forward. People are going to retract, right? And so when those people retract, that means there's going to be more opportunity for us as a practice to service more people.
Yeah.
And then because we're focused on the people and there's the people servicing those people, that is going to stand out a lot more because people do want best service. I mean, I think people get caught up in the cost and price. And there's some people who just want, the cheapest extraction ever, right?
Right.
That's fine. I get it. No problem.
Yeah.
But at the same time, if they're getting an extraction, they want the best service, the best care, the most gentle doctor, one who's thorough, knows going to take care of you. You want all those things.
Right.
Right. And with that, there is a cost of not paying for that initially. Right. So there's a great opportunity. And so as we are able to be hyper intentional, team is focused, living by our culture, providing the service by taking care of the people, because that is our business. We're going to continue to make our three practices prosper in a sense, service more people, but then also because of just the nature of when things happen, people pull back, hopefully be in a position where we can actually begin to scale and touch more people's lives. So now it's kind of like the real estate of not only the internet, right? But now the real estate of the community of Charlotte and maybe, who knows, perhaps North Carolina, right? Yeah,
that's awesome, man. And it's been an honor to work with you guys. You're very favorable, not even just from seeing you guys online as much as we do, but also what you're doing in the community for your patients, for your teams, for the overall great value of this this city. So keep doing what you're doing, man. I'm looking forward to getting on the other side of this with you, and we do this together. And I'm excited to share this out there because I think, marketing agencies, dental practices, business owners, people, they need to hear this. They need to hear the value and understand that it's about, it is about the service and providing value from a business standpoint. And I think you guys do all that. So keep it up. I'm looking forward to 2020, even though it's been crazy first part of the year. But hey, I appreciate you, man. And any last words you wanna set us off with?
No, man, thanks, man. I appreciate the kind words. And yeah, man, we got this. Let's do it.
Yeah, absolutely. Absolutely. Well, Dr. Taj, I appreciate you, man. Have a good rest of your day, and I look forward to dominating 2020 with you.
I send that plan.
Thank you.
All right.